Hi, everyone. I'm Dr. Joe. Well, before I say what my name is, does anybody remember what my name is? If you can get it right, I'll give you a lottery ticket. Well, I like it. She got Dr. Gorz. This is going to be an interactive presentation this morning, guys. I got 30 of these to give out. So you're going to want to be involved in this as we go through this. We're going to be talking about primary care and what that means for everybody. And then we're also going to get into a little bit of what all these tests are. Why do these docs send me for all these tests, and what are the reasons? And how long do I have to do these gosh darn tests for, right? So, all right, we're going to start out with mammograms because what month is it?
October, breast cancer.
Awareness month. She got that one. I'm coming over here. So she got the awareness month. See how this works, everyone? Here you go. You get a lottery ticket. Well, you know, I'm not here to stump anyone today. So when do we start doing these mammograms for a normal person? What age? Oh, I'm sorry. Yeah, absolutely. So, you're incorrect there at 30. Let's try again. Who knows when we start for mammograms? What age?
Is it 45?
Not 45. Go ahead. This is good. I like this. Let's do another one. 40. You got it. All right. Come on up, or you want me to come to you? You want to come on down and get your lottery ticket? So we start them at 40 years old, our mammograms, and we screen once a year with this, okay? And we're going to do that into our 70s, but some recommendations now are going all the way up into our 80s. Now, if you have a family member, what we call a first-degree relative, either your mom, your sister, a daughter that has breast cancer, you may need to screen earlier. So for instance, let's say mom had breast cancer at 40, you would start out, if you are a female, at 30 years old, you go 10 years earlier. So let's do another one right here. So if you have a family member who had breast cancer at 38, when do you start screening?
28.
Boom, nailed it. All right, we got a math whiz up front. All right, 28.
10 years.
10 years earlier. All right. Any questions on mammograms before we continue? Go ahead.
Are digital more accurate?
So it's a great question. Yeah, what you're looking for today is the 3D mammography. That's going to give you your best imaging, and it's a two-view system. So we want to get both views, and it really does help. We can get about 84% accurate with diagnosing things. Nothing's perfect, and you try to get the mammogram at the same facility each year because the radiologist who's reading these can compare the image from the year before, and that's going to be beneficial. Any other questions on mammograms before we keep this going? Go ahead.
Is there any age that they stop doing mammogram?
You know, it's a great question. They say with your recommendations you can stop at 70, but we're really looking more and more of the literature to even go into our 80s or even get screening on. For me and my patients, I like to continue to send them all the way through. We're living longer and longer, and there's more and more advances. You know, if we catch things early enough, these treatments can be as simple as a pill, a little radiation. You know, it's not the days, and there are more aggressive treatments, and those are scary, but if we continue to screen yearly, we can really prevent things. Go ahead.
I know that
Men can get breast cancer.
tests for men.
There are tests for men. We would do an ultrasound, or we would do a mammogram depending on body habitus and size, but men do get breast cancer. There is no current recommendations for men to do yearly screening or any age unless there is a family history or a genetic component with that. But those are very isolated cases.
So if there's a history of a male having the cancer, they would.
You look at future relatives in the primary lineage line, sons, grandfathers, things like that, brothers. Anything else on mammograms before we go to our next topic? Let's talk about colonoscopies. All right, here we go again. This is a recent change. So I'm going to go with the recent change that just went into effect in 2021. When do colonoscopies we start screening for them? Boom. All right, I'm coming down to you. So let me walk down here. We'll get you this, and then we'll keep going. Here you are. You're welcome. So with colonoscopies, we moved it to 45. It used to be 50. And this is kind of scary if you think about it. They think it's what our diets are doing. We're seeing cancer so much that we've decreased it down to 45. And in certain populations, we've dropped it down to 40 with these screenings. We're also looking at, is 10 years, is 10 and good? Should we be doing every 5 years? And those guidelines are being talked about. They haven't been put into place. So right now, it's a normal colonoscopy, repeat in 10 years. But in the future, don't be surprised if we start screening every 5 years. And that is coming down the pipeline. So, all right, let's continue on. Who's heard of Cologuard? All right, so with Cologuard, let's talk about what it is. Cologuard is a test where you put stool into a jar and they send it in and they look for genetic markers of cancer. Now, the tough part with this test is they've got a great advertising campaign, and I do use Cologuard, but you want to be careful because in certain cancer strains, you can have up to a 40% false positive rate. So, and you got to repeat it every 3 years. And sometimes the insurance doesn't pay for it if you get a positive Cologuard and you have to go for a diagnostic colonoscopy, so it can be more money out of your pocket. So whenever you can, I do recommend going for colon cancer. Going for the colon cancer screening with the colonoscopy, excuse me. Okay, everybody hearing me okay? You have a question? Right now, they recommend up to 80 years old. So, but again, these are guidelines. We're living longer and longer. If you want to get them, I write them for my patients after the fact. Continue to go on. Do not let age define you on your testing or your screening, you know? There's always risk for perforation anytime. The risk does go up the older you are, but it is minimal. Other questions? Go ahead.
I just had a colonoscopy.
Okay.
And they found that I had Crohn's.
Okay.
Now, you said 80 is the year, so am I going to have a colonoscopy after 80?
With your isolated thing, yes. And that there's some other risk factors that increase your chance for developing cancer later, and we can talk more about that off mic. You're a little more of a specialty case. Any other questions before we kind of keep this going? All right, let's kind of focus on the men now. November is right around the corner. We're going to be talking about prostate. Does anybody know the blood test that can help us with diagnosing prostate cancer or screening? All right, I know you got one. I'm going to give him that one. All right, I couldn't tell who did it first, so here's your PSA. She got it? All right, he said you got it. There you go. All right, so you might notice that in some of your doctor's offices, they're not doing the rectal exams anymore on you. And some of the reasoning for that is that the exam, we don't get to feel the whole prostate. Some of our physicians out there might not know the exact spot where the prostate even is in some of the retrospective studies. So they're looking more for screening with a PSA. Now the PSA gets a little controversial. Can you believe it? Doctors arguing amongst themselves. So you've got the primaries and the internists, and they go, let's start screening for PSAs at 50. You got the urologist that focus just on the prostate and the urogenital bladder system, and they say, let's start screening in your 40s. So depending on where your doctor's at, what specialist you're with, they might start screening at 40, might start screening at 50. I tend to go with the specialist guys are telling me, and I start screening at 40. So you might want to ask that question. Any questions on prostate right now? Nothing. All right, you guys, I'm sorry, go ahead. Women don't have prostates. Yep. No worries at all. It's a great question. It's a great question. Women do not have prostates. All right. We'll continue on. No worries at all. Let's continue on this morning. Let's go to bone densities. Let's go to bone density scans. Let's talk about it. Who in this room has had a bone density scan? Okay. So pretty harmless, easy to go in, easy to do it. A couple things have kind of changed. In the past, we used to say your normal osteopenia or osteoporosis. We've kind of simplified that now. We either say you're normal or you got osteoporosis. So, does anybody know what age we start screening for a normal person? We're doing bone densities. And you have to answer what is in the question. I'm just kidding. Keep going. It's higher. Who said 60? All right, got another lottery ticket. I'm coming down to you. There you are.
Do men have to get them?
We're going to talk about that right now. We're going to get into BMIs. So traditionally, we start at 60 years old for bone density scans, generally every 5 years, depending on what we find or precursors. Now, there's certain things that we want to look for. Your BMI. And BMI can be a controversial thing. You see it in the news, how it's accurate, different things. But generally, if you have a BMI under 21, we want to do the screenings a little more often because we can see an increased chance in osteopenia or osteoporosis. So based on your BMI to answer your question.
So then, the skinnier you are,
The more likely you are to have bone issues. Yes. Yep, it's good to have a little meat on your bones. Not too much meat though. Let's talk about some of the treatments and some of the options. So right off the bat, especially for our female population, I say right at 40, start with a good calcium, a vitamin K, and a vitamin D pill. That should just be in your repertoire all the way through. If you develop osteoporosis, we have a liquid that you can mix in. You shake it up, stir it around. Usually you pick Friday mornings, you drink it. You have to stay sitting up for 15 minutes because it can be a little acidic and cause some issues in the throat, and you do that once a week. We also have injections that we can give. There's depending on if you have a pathological fracture, we would use one type of injection versus a non-pathological fracture. The problem with the injections is once you're on them for life, and you can't stop them because you would increase chances of some hip fractures. Any questions where we gone there with that? Yeah. Well, that's what we're just talking about, some of the different treatment options you can have. If you stop it, yes. So, yep. So you're talking about really your hip bones, a couple of things in your spine, yes. I'm not sure what you're referring to there, but we can talk more offline. I've not heard of bones taking to other spots in the body. Yeah, but we can talk more afterwards, but it generally doesn't take bones from one bone and puts it in another bone. It can, yes. Yeah. Yes. All right, any other questions?
Could you repeat the questions?
Oh, yeah.
It's hard to hear some people.
Absolutely, I can absolutely do that as we continue to move on. So we were just talking about different treatment options for osteoporosis. And we were talking about either oral medications versus injectable medications versus infusions and the duration and how long you have to be on them for and what they are. And again, with any treatment, you've got to talk to your doctor for your individual plan. Are you on the med because you had a pathological fracture? Are you on the med based on your score, based on your risk factors? Oh, sorry.
So sorry about that.
No, you're fine. Everybody hear me? Go ahead.
So if you're diagnosed with osteoporosis.
Yes.
And you go on a treatment,
Yes.
does it maintain you at the point that you're at when you're diagnosed, or does it actually improve the calcium in your system? And
Improves.
How long does it?
It improves, yes.
Well, how fast then? So
Well,
say I'm 70 years old, and how many years is it going to take to improve it or get it back to a good normal state?
again, it depends on what your score is and what your level is. You know, are you a negative 1.5? Are you negative 2? Are you negative 8? Are you negative 0.9? You know, which parts are having bone demineralization? We check not just one bone area. There are machines where they could just do your thumb. There are machines where you could just do your wrist, the portable ones. You'll see them at fairs like this. Generally, we do a scan and we look at a few different bones within your body when we do them. So it's not a fast and hard rule that says, you take this in 3 months, you're gonna have 20% increase in your bone mineralization. It's not that hard and fast. It's an individual thing. All right, so let's continue on. Any questions before I continue on with everything? All right, let's talk about vision. So who here has a little trouble seeing things or has to use corrective reading lenses? All right, does anyone know the name and the phenomenon that happens because of this? What was that? No, not macro degeneration. That's a little different. What we're talking about is presbyopia. So our lenses and the muscles that are in there contract and go down. And it's a natural phenomenon that affects us all as we get older. Generally in our 40s to 50s, we start to lose our nearsighted vision. We have to get the readers. You know, you go to the hardware, you grab them off the counter and you put them on there. This will affect everyone. So that's why at that age, we kind of recommend that you start going and get your eye exams, either with an ophthalmologist or an optometrist. An optometrist is someone who does 4 years of undergrad and does 4 years of school and then goes out and practices. An ophthalmologist is someone who does 4 years of undergrad, 4 years of medical school, and 5 years of residency. And then depending on other treatments and depending on other specializations, might do an additional 1 to 3 years. So just knowing where you're at and what you're looking for in different tests. Also, that could be great screening for cataracts. And we generally see cataracts starting to form around 60, but you know, some people it can be in their 70s or 80s. Also can affect if you have comorbidities or other things like diabetes or other things like that. Any questions on our vision as we're going to kind of continue down this line? All right. So, has anybody heard of presbycuria now? We just talked about presbyopia. Has anybody heard about presbycuria? So this is a natural phenomenon. And I think today some people, even in the room, might be experiencing it with a little difficulty hearing. This happens generally starting at 60, and until the time when we move on, your hearing steadily decreases every year. Just boom, 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 steadily down. And that's called presbycuria. So we do recommend, you know, starting at 60, 65, if you're starting to notice those things, to go see an audiologist and look for hearing aids. There's an association with people that have decreased hearing and developing dementia. And no one wants to develop dementia at all. So it's something to bring up with your doctor, you know? Any questions so far as we continue on? All right, we're gonna 2 lottery tickets here to come back out, see everybody's paying attention. What's the thing called when your vision starts changing at 40? He's got it. Man, this guy's cleaning up today. All right, we're going to do the next one. I'm going to have him be quiet for a second. What's the one where you have the hearing? What's that one called? Sounds like the other one he just said. What was it? It was presbycuria. Leaving lottery tickets on the table here, guys. All right, here you are, sir.
I do have a question about the
Yeah.
vision one. I know you said, well, of course I wear cheaters,
Yeah,
and it's just my for an eye exam, you know, you have to go for surgery, but not yet.
yeah.
I know that they can do laser, is that something they can do with just readers, or do you have to be a little more advanced than you have to?
Yeah, absolutely. So we're going to get a little lost in the weeds with this question, but let's do it. So she's asking, can I avoid presbyopia with laser treatment, LASIX? Yeah, LASIX, you get your eye evaluated. Believe it or not, our eye is oval, is oval shaped. So depending on the depth and where it's at, certain people, if their eyes are too steep, won't be a candidate for LASIX. So that's an individual by individual case, but no matter what, it's just a natural aging phenomenon.
That's something my eye doctor
Discuss with you, absolutely. Any other questions before we kind of keep going here? Yeah, go ahead.
My father had developed macular degeneration. Can you talk a little bit about that?
Yeah, absolutely. So macular degeneration is a decrease in your vision either centrally or peripherally. There's a wet and a dry type. And what you can look for is a thing called an Amsor grid, which is just a piece of paper with a bunch of little boxes on it, and you can kind of scan and see if it's there. And if you can't see all the little boxes everywhere, you might have an area where you're not seeing your vision in, or if they're a little wavy, you know that this could be a precursor. And that's when you would want to go in and see an ophthalmologist at that point. So, any other questions before I kind of do a little plug here about diabetes? All right, so since we're talking about vision, if you've been diagnosed with diabetes, and that is an A1C of 6.4 or greater, they do recommend yearly diabetic eye exams. So just make sure, if any of you in the room, and I'm not looking to tell me your medical history right now, but if any of you have diabetes, whether it's controlled or uncontrolled, you should the rest of your life have a yearly diabetic eye exam. Because you only have 2 eyes. Okay. You were gonna, nothing? Okay. I just looked like you were to ask a question. So we're gonna continue on. So we're gonna transition a little bit from testing and we're gonna go into the blood work side of things. Okay? Let's talk about a CBC, which is a blood count. So when you go in your doctor's office and they draw your blood, it's not all the same. And I get this question all the time. People go, I have blood drawn there. They've looked at everything. There are hundreds of order sets, even thousands of order sets. So just because you had your blood drawn doesn't mean we all look for the same things. And I get that question quite a bit. So when we come in, we do a CBC. We're looking at your hemoglobin. That's what carries the oxygen around the whole body, and we see where it's at. We look at your white blood cells and the subtypes, whether that's neutrophils, monocytes, lymphocytes, eosinophils, or basophils, and we look at your platelets. How well, if you cut yourself, does that coagulate off? Any questions there as we continue on? So then there's a CMP, which is your metabolic panel. We'll be looking at your electrolytes, we'll be looking at your kidney function, and we'll be looking at your liver function, your ALT, ASTs. One of the things I want you all to pay attention to is your GFR level. And if you have protein or blood in your urine, because there's kidney disease in this country continues to rise. And it's something you want to keep a very, very close eye on, because kidney disease leads to a lot of different health problems. So when you look at your blood work, there's certain things you want to go down and look at, and one of those would be your GFR. Any questions so far as we continue on? You'll see an A1C, and I get this question quite a bit. Dr. Gorz, well, my glucose said it was 100, or it was 70, or it was 80. Well, or it was 200. I'll say, well, did you have a donut? Were you fasting? So the glucose we don't use to diagnose diabetes anymore. We use something called an A1C. So what that looks at, believe it or not, is your red blood cells. All they eat is sugar. And they'll look at your red blood cells live anywhere from 90 to 120 days, depending on your age. So it gives us a window into your diet over the last 3 to 4 months and tells us, hey, you've got a little sugar resistance, or you're a full-blown diabetic. So pre-diabetes is 5.7 to generally 6.4. There's some literature that says 6.2, but let's do the benefit of the doubt and say from 6.2 to 6.4. Anything above 6.4, so you're 6.5 and above, you are diabetic. Is everyone with me so far on that? So that's a really good number to pay attention to, okay? All right, what was that test I wanted you guys to pay attention to about the kidneys? What was that one test I asked everybody to remember? Boom.
What is a good number, like if we go back and look
Yeah,
at blood work?
absolutely. We pop back up there and I'll answer it.
Thank you.
Yep. And I swear I am going to come to the end and let the next speaker come in. So the question is what's a normal GFR? Where are we at? Anything above 90 is a normal GFR. And I want to preface this, just because you get a level that might be 1 time below, that doesn't mean you have kidney disease. You might have been dehydrated that day. You might have had too big of a workout. You might have had an extra beer the night before. Your kidneys, you might be on Motrin. There might be things that affect it. We generally do 2 diagnoses of GFR that's lower, and we look at the urine, we look at certain things. That's why we're always taking your urine. We want to see if there's protein, if there's blood, if there's glucose in the urine. That helps us gauge what it is. We diagnose kidney types by 5 stages. Stage 1, stage 2. Stage 3 is 2 types, A and B. Stage 4, and stage 5, unfortunately, is when you're on dialysis. So, all right, let's continue on. So during your physical, you'd also recommend that you get a TSH and a free T4. This allows us to get a really good look at your thyroid. It allows us to see how the body's processing and how we're going through it. So you always see those tests. I like to do a vitamin D on all my patients. Vitamin D is a wonderful vitamin, and I recommend everybody in this room should at least be on 2,000 units. Unless you've got some osteoporosis stuff, we would talk about a higher dosage. So we would always do that test. We would continue on with the test, whether you're male, we would order a PSA and a testosterone. And those are the basic tests that we do order. And then if we're following you for other things, we would order other individual tests. Okay? So as I wrap up, I'm going to ask 2 more questions. Who remembers the name of my practice? Go. It was Neighborhood Primary Care. And who remembers my name? All right, I heard, I think 4 people said that, so I'm going to give out 4 tickets. Here's one for you. I got one right here. Yep, I got one right here. You're welcome. I think you got one right here. You cleaned up today. Oh, you didn't? Okay. Honest, I like it. Anything else before I finish here today? It was a pleasure seeing all of you guys. Hopefully you come over to my table, say hi to me. I'm right next to the Dollar Tree in Dunham's on Lake Orion, Michigan. We have a little mom and pop shop. It's me and 3 other people. Everybody gets my home cell phone number. We're not trying to be the biggest people in town. So thank you again for being here today.
Military families often sacrifice precious time away from loved ones while serving our country. And for those with children, the separation can be especially difficult.
We were worried that with him leaving, that she would lose those connections with her dad.
Some of life's best moments happen between parents, children, and the pages of a good book. United Through Reading provides that connection.
You can watch your mom or dad read a book to you, and it almost feels like they're really there.
We ensure they remain a consistent, meaningful part of their children's lives, no matter the distance.
Just seeing Jacob recognize Daddy again after a long time just melted my heart.
And now, as we're facing greater isolation from our loved ones, United Through Reading is also available to veterans. Learn more about United Through Reading and download our free secure app at unitedthroughreading.org.
Your password isn't secure. There's nothing that a hacker loves more. But there's an easy thing you can do to prove the logger in is you. Authenticate, strong authenticate. Make your logins extra safe. Protect your identity from tragic fate. Authenticate, strong authenticate. Use your fingerprint, your face, or a code. At home or work or on the road. 2 steps are safer than 1 or 3 or 4. And keeping data safe is so much fun. Authenticate, strong authenticate. Make your logins extra safe. Protect your identity from tragic fate. Authenticate, strong authenticate.
Kids across America are going to school hungry. Millions of kids every day. Hungry kids get sick more often and can struggle in school. It can be harder for them to focus and learn. But one simple thing can help change all of this for a hungry child in America. Good, healthy food and the energy it brings. With help from caring people across America, No Kid Hungry is providing healthy meals and hope to hungry kids so they can build better futures.
We want to ensure that all of our kids have healthy meals every day.
Thank you.
Thank you for helping feed our kids.
To learn more about ending child hunger in America, go to helpnokidhungry.org today.